the ethical nature of doctors going on strike. Yes, to a large extent, people will say that in this regard, you have shown a large amount of restraint by issuing ultimatums. But then, couldn't you have shown a bit more, especially considering that negotiations were already ongoing?
Yeah, I think I like twisting this in this way. People always want the doctor to, bend over so much backwards that he will break his spine. And then when he breaks his spine, nobody will treat the patient. I think right now the public should start putting pressure on the government to consider the vital nature of the doctor's role in the health sector and start pushing them and not just saying, we've been on this for years. So I think the doctor knows why, and that is why we take our time to write them, inform them, to say, do this for the Nigerian doctor. So I think the public now should, get government to do what they're supposed to do.
But hasn't that always been the idea? I mean, is it that when you go on strike, is it that government officials use the hospital? That's the reason you're going on strike. Are you trying to punish government? It is the Nigerian people who will eventually suffer it.
No.
And when you think about, the pains that they're already going through, do you think that we should have additional pains? Yes, you're Nigerians, but look at the people who actually go to the hospitals to use these facilities.
Yes, the word punish should not be there. That's not the intention.
But that's what a lot of people go through.
Yeah, but we're not punishing them. You see, we are getting government to do what will help the patients. And they should appreciate that fact, that if they get it right, they will be better off for it. We need a working health sector in this country. Do you know how many doctors are living in Nigeria? I mean, and it's because of all these, mistrust, all these things happening in the government. So the public should appreciate that we want to preserve the health sector for them. And that's what we're doing. We want it to work.
The question is, at what cost? At what cost? That's the question.
Well, the consultants are working. You should know that. So, they could still go there and get some work, get some help.
But know.
You see, at the cost, it is better you take the pains now and get it better, later on.
Dr. Ogochukwu, you and I know that, resident doctors constitute the bulk of staff at, many government hospitals. So when you say that the consultants are working anyway.
Yeah, they are.
And now, would that be a fair comment?
Well, for now, we need to press home some of these demands to get, the hospitals to work in Nigeria. Perennially, the hospitals have really, really been suffering. So let's get it right this first. And I can tell you, we have to get it right. That trust must be there. If that trust is not there, the doctor is not secure working in the hospitals, I can tell you. And we want to ensure that that is done. Well,
government has called you back. You've been having these negotiations. They're saying they're going to pay. From what we hear, you say that perhaps when we hear that the conditions are that if we get our arrears paid, we might call off the strike. So are you saying that if you get the alert today, essentially, because it looks like promises that it has already been paid to the banks will not be sufficient until it hits the accounts of the doctors? Is that what you're asking?
Definitely. Definitely. It must enter. If it doesn't enter, we can't guarantee industrial harmony. I can tell you. We cannot.
Are you saying that you completely do not trust government?
Well, they have to demonstrate that they have to show that they can be trusted.
Is there no way you can also extend to them benefit of the doubt? Because when government says something, people, trust must be built. But then at the same time, you also must give benefit of the doubt.
We have given that a long time. This document, like I told you, did not come into play this year. 2013, 2014, it's been there. We've been writing. We've been writing. Can you imagine, one of the cases, PENCOM. Since 2013, government stopped remitting their counterpart funding for 2013, when there's a PENCOM Act. Are you saying they don't know these things? You write them. Embarrassingly, even the Office of the Head of Civil Service wrote to say that doctors are not pensionable. Nobody could imagine that. Well, look, government should demonstrate, they should show that they are sincere.
Interestingly, these are the issues that you raised, and according to them, they agreed with you on every single issue that you raised.
As at the last meeting.
As at the last meeting. Yeah. Wasn't that enough?
No. Agreement, this is not the first time government is agreeing. So that is why we want to see, we're in the age of evidence-based medicine. We must see evidence of that. We must see it. If you don't show us evidence, nobody is going back to work. I can't guarantee that.
According to them, they made phone calls at that meeting. And in some instances, there were confirmations of some of the things that they had said.
Yeah, that was false. In fact, I was with one of the CMDs. I don't want to mention him. He came specifically for that purpose. He told me that he heard that they called him, one of the CMDs from the Southwest, and that nobody called him. And that, like I told you, they said they called. They wanted to twist the meeting. And we confirmed nobody paid anything. So, I mean, if you were the person, I mean, you wouldn't trust such people. They should get serious. They should get serious. I mean, we're not kids. They should get serious. You can't be toying with doctors after so many years. These are specialist doctors, you know. They are not just, they are specialist doctors. So, government should get serious.
So right now, you're going to be meeting with your members today?
Yes.
What are the terms of settlement that you finally have with government?
Well, from the last meeting, well, first of all, I want to talk about, they said there will be alert yesterday. We haven't received that. Maybe this morning something will happen. I don't know. But leaders are coming from different parts of the country to discuss that. And then the other things will require a little bit of time, letters, secularization, to do all those. First batch to be paid. Second batch of the people, they say they should get the mandate by yesterday and today. We will confirm whether that mandate to pay is even not that the money to be paid. Second batch, the mandate. So if we don't see all those things, I mean, I don't know what will happen.
Strike continues.
The NEC will decide.
But we're already getting hints, we're getting pointers.
Well,
government says that they've done everything to pacify you, and they're
everything.
Saying that's what they claim, and they're saying that if you do not call off your strike, they most likely will have to sack the doctors.
We're not threatened by that. I mean, do you know how many years I put in training? You say you want to sack me. Who is afraid of sack? Who is afraid of sack? Specialist doctors, sack. Government shouldn't threaten anybody with that. We're not afraid. We are specialist doctors, so that does not threaten anybody. I mean, they should perish that thought.
But at the end of the day, you know, you have a call to serve.
We are serving, and we want to serve you better. You should be worried. You travel abroad, I know. You travel out. You see how the health sector works. That's what we want to do. We want it to work. Government should help doctors, and doctors we are willing, we are working, and you're not paying us. You're paying other people. What do you want us to think? We want this place to work, and that's why we're here. So many of our colleagues are outside. They are paid better. They are doing their job. We work extra hours, then you don't want to pay us.